The second one, which we're really excited about because it's something we're actually going to do, is for Parkinson's disease. And for this, it's actually a clinical study in that in collaboration with the Radboud University Medical Center in the Netherlands, they have a cohort of about 300 patients who are going to have their brain fluid collected, which is a very painful procedure through a spinal tap. So that's not something you can do all the time to check your brain dopamine levels and their blood, which is much more accessible. And for Parkinson's patients, currently the only treatment for a lot of their motor symptoms, such as shaking, is levodopa, which is the dopamine precursor. And levodopa is orally taken, and the hope is that it goes through the blood-brain barrier and makes more dopamine. But of course, levodopa will also circulate in the periphery first, and there are enzymes in the gut and the blood that can convert it to dopamine. And once it becomes dopamine, it can't cross the blood-brain barrier, so it's not really doing its purpose. And a lot of patients have a lot of side effects because it could be the blood dopamine is toxic, so it's actually not going through the blood-brain barrier. You have a lot more dopamine in the system. So the patients actually take a co-administered drug called carboxydopa, which then blocks the enzymes in the gut and the periphery. But again, that's so dependent on the metabolism. So if the patient ate something that morning, did some exercise, depending on their age, their health, their gender, whatever it is, it's very different, but it's not a personalized treatment. So in this study, we're trying to see whether there's a correlation between L-Dopa drug dosage versus blood dopamine levels versus brain dopamine levels. If there's a correlation, then blood dopamine would be a very good feedback system for patients, where I think it's a very frustrating disease because there's only one treatment and it works sometimes, other times it doesn't. For some patients, it doesn't work at all. And we have to figure out why is that. So I think what's really exciting about this project is that I always thought that we're very much focused on fundamentals still because there's so much that is unknown and it's such a black box. But I think we're finding ways to actually support patients without, claiming we're going to solve the disease, but to improve the quality of life or to give them feedback for their drug dosing in these kinds of systems where we can quantify molecules that could be important.